Welcome back. Again with me is the esteemed wound care expert from Ohio, Dr. Ravi Kamepalli. Ravi, congratulations on that course.
Thank you.
It took
Thank
a lot
you.
of work to put together. The cases are outstanding.
Yeah.
And you look a little different to me today. Did you discover Rogaine, or what the heck happened there?
Well, that's when I go back to India, I go and visit my deity, and we go and offer my hair in penance for the sins that I commit, and that happens almost every year.
So we caught you right after a penance, huh?
Yeah,
Well, that's
I was
fabulous.
pure then.
That's fabulous. You're always looking dapper to me, whether it's with a robust rug or without. I wish I had as much hair as you, actually. But Ravi, let's talk a little bit more about the practical approach to problem wounds. Tell us, again, what you think the benefit to a learner would be from that course. Let's say someone new in wound care. What are they gonna learn by registering and taking practical approach to problem wounds?
Everybody looks at wound care as a big approach, but what I look at wound care is as a problem-focused approach, wherein each case is a problem, but now trying to take it's like peeling an onion and taking the core out, and each problem, when solved, the wound healing happens. Now, case-based approach is the right way, and bedside learning is the right way. And for me, I think I've been kind of waiting for WebCME to come along, I guess. And I've been collecting this case without even knowing that I would be ever coming along and knowing about WebCME and getting along and teaming up with you to do this. Because everything that we learn is at bedside. We might sit in a hall and listen and learn, but trying to learn at the bedside is the best way. And what you learn at the bedside, bringing it out and teaching people, is the telemedicine or distant learning. And so that I think WebCME kind of fills in that gap a lot.
Well, it certainly is. Yeah, it certainly is a platform for distance learning. As a matter of fact, I just received some correspondence from Miguel Cortez from Manila. Miguel is one of the individuals that I met at the Philippine Wound Healing Society. Again, I'd like to say hi to Miguel. And again, thank you for your hospitality in Manila. But what we talked about, Ravi, is exactly the case here. Here we have someone sitting in Manila watching this presentation here live. They can access the online learning 24/7 from anywhere in the world. And I think your dream is very similar to mine in that we want to take this platform and take this education to the world and make and raise the standard of wound care and the practice of wound care worldwide.
Yeah, my dream is doing what I do and taking it back to India to see if I can replicate what I do with this process in India, so that I could give back to where what the country of my origin made me what I am right now.
Fabulous. Hey, listen, I know you can't see the teleprompter, but there is an email that has come in that I would like you to address. A specific question for you was submitted, and the question was any offloading devices used as part of the healing process for the management of the diabetic patient that you illustrated in your case?
The process of healing for this gentleman was that he was totally offloaded. The foot was elevated completely, and he was not ambulating much because of his problems with congestive heart failure. And essentially, it was totally offloaded. And the problem is that we addressed him with arterial insufficiency first. He had a severe peripheral vascular disease, and angioplasty was done, adequate blood supply was gotten, but he had congestive heart failure, so we had to do compression therapy, and we had to prepare the wound bed and remove the barriers to wound healing. And as you saw, the amazing granulation that happened, and within 6 weeks, we deployed adjuvant therapy to heal, and then he went on to do a good healing. And he survived almost a year after that, and he died because of these congestive heart problems. Yes.
That's fabulous. So let's spend a few minutes talking about offloading. What is your offloading device, your favorite offloading device, and what do you typically deploy in your clinic? Can you comment on that?
I don't do most of podiatry and of help. There is a podiatrist. We have total contact casting.
Again, that team approach. You're bringing in that team approach.
Oh yeah. There is no question. I don't try to kind of keep everything to myself. I make sure that if I need another body to help me, I'll be liberal at doing that, because I cannot achieve all this by myself. And my team with my podiatrists make a core of what I do, and with my plastic surgeons too. And I come up with ideas, and sometimes they come up with something, and we team the thing, and including nutrition and all. And coming to the offloading devices, we try to offload it as much as possible. We try to do some rollouts, try to keep the foot off, and try to educate the patient that one step is one day behind for their healing. And that kind of provides them an idea that they want to heal better, so they won't kind of put weight on it. So I try to see as much as possible. We deploy different devices, but everything has to be tapered to patient as they come along.
Sure, absolutely. I mean, you mentioned total contact casting. Here in Milwaukee, we do a lot of total contact casting. The company that I like to work with is MedEfficiency. They've got a great system. And for those that are listening, they actually have come out with a new device, an EasyCast. This is a very slick device, very simple to put on, excellent outcomes. And the thing that we like about these casts, I'm sure as you do as well, Ravi, is that, again, it doesn't limit your patient. These patients can go in the hyperbaric chamber. We perform negative pressure wound therapy under these devices. And so it's a very versatile device that performs excellent offloading. If anybody is out there and wants to speak to my world expert, Dr. Ravi Kamepalli, please give us a call at 414-385-2999. And you can also email us at woundroundslive.com. If you would like to send in a text message, we'd be happy to do that as well. There's nobody on the line right now, Ravi. We'll give a few more minutes. But if we get no one else to call in, I'd certainly like to once again thank you for your time. I know you're a very busy physician with an active practice, and I know your time is very valuable. Once again, I would encourage our audience to check out The Practical Approach to Problem Wounds by Dr. Ravi Kamepalli. I know you're very easily accessed, maybe not on a minute-to-minute basis, but I know you respond very well to emails. And if anyone in our audience wants to contact you directly, Ravi, are you adverse to corresponding and discussing some cases?
No, I'm always available, and email is the best way. And my email address is nobadbugs, NOBAD bad BUGS @gmail.com, and my website is nobadbugs.com, NOBAD bad BUGS.com. That's my website.
nobadbugs@gmail.com. Fabulous. Well, Ravi, again, I'll let you get back to your patients. Thank you so much again for spending time with us on Wound Rounds Live. And would you be interested in coming back and co-hosting a session with us in the future?
Yeah, I have more amazing cases. I think after the 60 cases, I almost have say 120 or 150 of them more.
Well, we'll talk about doing the next episode of Practical Approach to Problem Wounds, or version 2, if you will. But again, thank you so much for your time. You have a great day, and enjoy the weather there in Ohio. The winter's been mild here. How about you?
It's been very, very mild. It's very, very mild.
All right, Ravi. You take care of yourself. Nice talking to you.